I'd like to welcome everybody to the Halacha Medical in Kippur conference, the annual conference that we hold once a year with all the shilas which come up. Fasting about Yom Kippur, general shilas, and the shilas for pregnant, nursing, postpartum questions. Would like to thank very much Rabbi Fuerst for making the time today to address us and give us the psak halachas. We'd like to thank Dr. Dinner and Dr. Abittan for making themselves available to answer the medical side of these questions. For those who are new to Kabbalah, we'd like to welcome you. Kabbalah is the worldwide halacha hotline where we have, Baruch Hashem, over close to 80 Rabbanim answering 24 hours a day. Shilas from all over the world. The Rabbanim are located all around the world, so we have coverage on all time zones. Baruch, for those who haven't yet signed up at kabalacha.org, we have the updates and newsletters. For those who are not yet familiar with the phone numbers, in America, our phone number is 732-707-6666. In the UK, it's 020-4538-4538. And in Eretz Yisrael, it's 0553-200-200. Today's conference of the shilas of people which have sent in regarding fasting. Many of you might hear things which might be applicable to you, but might not be exactly your case. So therefore, we asked you to speak to your local rav, check with your local doctor, or you could call Kabbalah at any time of day or night to check and make sure not to assume anything, not on the medical side, and definitely not on the halachic side. So we'll start with Dr. Dinner. We'll pose the shilas, and then we'll get the psak from the Dayan. Dr. Dinner, with us?
Yeah, we are.
Great. So we'll start with that shilas which have come in about people struggling with various mental disorders, be it depression, OCD, bipolar, other different mental disorders. The question is, when the anxiety, many times the anxiety starts building up closer to Yom Kippur or Tisha B'Av, and we want to have the basic guidelines, how important it is. Question A is those who are taking daily medication and those who take it just for anxiety or panic attacks on Yom Kippur. Is it important that they continue with their medication, and how important is it that they have to take it on Yom Kippur?
Right. Firstly, thanks for inviting me tonight, and it's a big privilege to be speaking with Dayan Fuerst. So basically, it is first. It's difficult to assess how severe a mental situation is, and a lot of it is subjective. But it can be quite severe, and the anxiety can build up to be quite extreme. Regular medication should not be stopped, specifically the antidepressants in the category of the SSRIs, because they have to be taken consistently. So we would even want them to be taken on Yom Kippur. But the as needed tranquilizers, people who have something that they use only as needed, don't necessarily have to be taken unless there's a need for it. And I think as the subjective need of a patient is taken seriously, and even on Yom Kippur, I'm not quoting the halacha, but what we understand is if a patient feels they really need something badly, we have to take note of that. So the consistent medication that people take on a regular basis should be taken consistently. Those that are not needed necessarily, only as needed, but they don't have to be taken. They can be left out.
Is there any reason that they would have to take, somebody who's taking these medications, besides taking the medications, is there any reason why they should be taking shiurim or needing to drink?
There's not, mostly not. Some people need some amount of fluid to swallow a tablet, and I believe it could be a bitter fluid or not a tasty fluid, but usually it does not have to be taken with food specifically, and usually they don't have to eat while they're taking it. during the fast. They can fast and take it, and it should not affect them.
And somebody who relies on for medication for ADD or ADHD, Ritalin or something similar,
Right.
how important is that for them to take it?
So again, that's not important in terms of their mental health. It may be important for their davening, for their concentration. If they do take it, first it's going to affect them more rapidly. Because they don't have food in them, there's a rapid absorption and they're going to feel the effects immediately. And when it wears off quickly and suddenly, and they may have side effects from the wear off, and they may even have quite extreme hunger, because what it usually suppresses your appetite when you take the stimulant. And then when it wears off, people get extremely hungry. So if it's possible, it would be preferable not to take it, especially unless it's extreme and the person's going to be so distracted and distressed by not taking it. It would be definitely preferable not to take a stimulant on Yom Kippur. And there's one point that if they have to take it, it's probably better to split it, to take a dosage or half a dose in the morning and a half a dose in the afternoon, so you get a cover for the whole day without having these drops, which could cause distress.
Dayan could enlighten us with any other halachic ramifications for people in the mental area of fasting? Dayan first.
I'd like to say that the medications you're mentioning, you may take it without water. Very often, these medications go, according to the doctors I deal with, they don't need any water whatsoever. Medication without water is no problem. It's not called achila, and that's okay. If they have to take any type of medications you mentioned, it could be taken without water. Sometimes the patient complains it's too big. So I tell them break it into pieces. Or try it out during the week. I had a patient just yesterday. He tried it out. It was too big, and he's going to have to take it on Yom Kippur. He tried it out without water. He broke it in pieces and tried it out yesterday. And he says it worked perfect. So that they complain they can't swallow the medication only with some water is really not true. They could swallow it. They can make it small enough and then take it the way it is without water. We hold water is chatzi shi'osim natayos. So we can avoid, if we can avoid using any liquids, we should avoid using. They should not use any liquids. Only when there's a chash of chodesh yesh b'sakana. But any medication that's on the market today, if it's a pill or tablet, if it's too big, they can break it. If it's not big, they can swallow it down with the saliva. They don't have to drink any water whatsoever.
They should break it up before attempting the water, even though they're used to taking it with water.
I don't break it beforehand. They should what do you call? They should break it and try it out during this week, and they see it goes. They won't have a problem on Yom Kippur also. You're allowed to break it on Yom Kippur. If they didn't break it for Yom Kippur, there's no isaf teichen. So they can break it. They can break it even on Yom Kippur. But the best thing is to have these patients that are taking these medications, have them try it out during the week. They see that it goes like this. They won't be so scared on Yom Kippur to take these medications.
Dr. Dinner, does the breaking up of the medication affect at all the power of medication, or if it's broken up?
Mostly not. There are some medication that have a lining to get through the stomach, because the stomach's very acidic. So it needs a lining that gets it through, and it gets absorbed or digested in the small intestine. They're pretty smooth and they go through, and they shouldn't really be broken. And also I saw a question about slow release medication, and that should not be broken up, because it's designed to be slow release. Once you break it up, it ruins the whole action of that medication. Shouldn't be broken up. But otherwise, certainly
But those don't come in a tablet or regular form. They come usually in a capsule.
Some in the capsule.
It's easier to swallow.
Yeah. Yes. Right.
So there's no problem. The ones out of the tablets, that you have to break up, they're too big and so on. But the ones that are, like you mentioned, that has to be time release, usually come in a capsule form, and those are easy to swallow. That's no problem whatsoever. Just down the throat.
There are a lot of tablets that are time release, but some people can swallow it. The only problem, it can happen, it can get stuck, and it can cause a bit of burning in the esophagus if it doesn't go down, if it's too big. But whatever you can do.
Right.
In reference to the ADHD, if somebody is doing it just to have more kavanah by davening, but that is going to affect him, that he's going to have to, he's going to be much more hungry when when the effect wears off. Is that better that he doesn't take it?
Yeah, for
concentration
sure.
for davening?
I would say yes. I would say it's better.
Better not to take it.
Yeah, there are slow release stimulants that work over a long time, so they may get you through most of Yom Kippur, and you could take it in the morning, and it'll get you through if the Rav permits it, because it's not a pikuach nefesh. It's a for concentration. So you have to, I would say, refer to the Rav.
I don't see a problem. They may take it as long as they take it without water.
Right.
But if that's going to affect them, that they're going to be more hungry afterwards, and then they might have to take shiurim, is that?
Yeah, but if it's long action, it could get them through most of the day. Then they could take it. If it's short action, it could be problematic.
Okay, we'll go on to the next questions. General guidelines for the elderly people and fasting. If it's older people, does it make a difference what age they are till the age of 90 or from 90 and on? How does it work? Dr. Din is a professional in aging.
Well, our claim is that 70 is middle age, so 90 is not so old anymore. So we don't hold age as a limitation to fasting. It's quite healthy, actually, for older people to fast. Obviously, there are more likelihood of having chronic illness. So usually, the chronic illnesses, and it may be multiple chronic illnesses, kidney problems, heart problems, that occur more likely at an older age. So that's an important factor, because that one has to take into account the overall health. But if just from the age point of view, there's no reason not to fast at any age. I don't think there's a particular age you say don't fast, depending on the person's general health. But again, we will be more cautious, because the older person is going to have frequently multiple medical issues, and each one has to be taken into consideration, whether they can handle a fast.
And so somebody sent in a question of an elderly, frail person, the 95 and over, who generally eats very little and is very weak. But is it in general, health considerations is generally okay, nothing in particular wrong with them? Is there a danger there, or should they have fluid? Is it necessary for them to have fluids at that age?
From a medical perspective, no. If they generally eat small amounts anyway, they could certainly try and fast. They would fit into the same category as anyone else if there are no medical problems. Obviously, if they show signs of problems cropping up during the fast, you would take it seriously. But I don't think milachatchila they could certainly start fast. I don't think there's a problem.
And how about a patient, an 86-year-old woman who has dementia, and also generally healthy but weak, but they can't express how they feel, and if they're not feeling well, if there's something bothering them? How do we deal with patients in that case?
I think it's complicated, because as you say, we don't know what's happening with them, and they're not going to react appropriately. So one has to be very cautious. I think from a medical point of view, we would act with caution and give them, more likely give them what they need potentially than not give them, because you just don't know.
Even if they're asking for it and they don't need it, you'd still.
I think if they're comfortable and they're relaxed and they're not complaining, you could try, but again, you don't. It's very difficult to have any subjective assessment of what's happening with it. So I think from a medical point of view, not a halachic, I don't know the halachic point of view, one would be more cautious, and you'd have to have a caregiver being watching carefully if there are any signs that they may need to drink or eat. That's what I think.
So the question to the day is,
I think it's important to mention that an elderly person has to be told there's no chiyuv to be in shul all day. He could come to shul for l'shachas, a little bit musaf, a little bit during the day. He should just take it easy, lay in bed. It's more important for him to fast on Yom Kippur than to come to shul and then come on to a chance of drinking or eating and so on. So the elderly person or a person who's sick coming to shul will make him eat or drink or something. It's better for him to stay home all day or most of the day and fast.
And what about back to the dementia? Somebody who's the children are there. Is there an issa for them to give food if they're not sure yes to give or not to give? So the doctor said you have to be more cautious. If they have a non-Jewish carer, should they rather give the non-Jewish carer to feed the patient, or if there's a chashash, so then it doesn't make a difference, and even the children could go ahead and also feed them?
There's a special issa of feeding them, if they can put just the food in front of the person. If he wants, he'll take it. If that's why I won't take it. Then that's the best thing to do. Sometimes you have a patient that has dementia, doesn't even know how to take the food or do with it anything. Then he should be fed, preferably a guy. If you don't have a guy, then even a yid could do it. We don't want this patient to get more sick because of Yom Kippur.
Right. Okay, then to general questions of people who are not feeling well. This shaila came in from one of the rabbanim. They say that somebody calls in and says that my wife's not feeling well. She's a bad faster. She just throws up very often when she's fasting. What's the status halachically and also medically of somebody who throws up? Is that a sign of beginning of dehydration that you have to be aware of, and they automatically have to have shiurim, or is it just to get rid of the bad taste? Halachically as well, are they allowed to wash out their mouth or even use mouthwash after throwing up?
So from a medical point of view, there are two issues that can happen. One is dehydration, and the other one is hypoglycemia, where the glucose drops. Usually that's going to happen to someone who's like diabetic and may have taken some medication to drop their glucose, but not always. For example, a few years ago, I had a woman who was on the bed. She could not move. She was sweating and looked like dehydration. So they were giving her water, and then they called me, but she didn't react at all to the fluids. Same status. It didn't help at all. So I told them to get some grape juice. She had half a cup of grape juice, and she got up and was fine, because her problem wasn't dehydration, it was hypoglycemia, and hypoglycemia is potentially dangerous. So I think if there are systemic signs, sweating, extreme dizziness, throwing up, one has to be cautious for any immediate danger, which could either be dehydration, which usually it isn't going to be dehydration, because if you've had a lot to drink before the fast, you don't get dehydrated within one day, unless people are walking outside and sweating a lot. But if they're not, then usually it's not going to be that, unless they start throwing up, and then they can cause themselves to become dehydrated. So vomiting is an important sign to be more cautious with. And if they continue vomiting, you have to do something about it.
From a one-time not feeling well and just one-time throw up, that's also.
I think if they threw up once and then settled down, you could wait. But if it's a generalized situation where they're feeling very poorly, and the other signs, sweating, extreme dizziness, extreme weakness, and throwing, you have to take that from a medical point. You have to take it seriously, both from dehydration and possibly hypoglycemia.
And what is the dain, washing out a mouth or using mouthwash just to get out the bad taste after somebody throws up? What's the halacha?
If they can avoid it, they should avoid it. If they can't, and if it's something like vomiting and something like that, it's like it says in Shulchan Aruch, it's dirt, you can wash it out. Nothing wrong. Someone gets himself dirty to wash out the dirt. It's not a chitza shel tainig. So if they can avoid it, certainly shouldn't avoid it. But if it bothers them a lot, let them wash out their mouth.
Mm-hmm. Okay, this is a question for the doctor now. Somebody who's just generally not feeling well, he can't pinpoint anything without any specific illness. Should they be fasting if they're just generally feeling weak?
I think if there's no specific signs, particularly a fever, any obvious objective signs of illness, I don't see a problem to them fasting. I think if they subjectively tell you during the fast that they feel very sick or something, then that's a question either if there's a doctor around to assess and decide if they need something, or to speak to the Rav. But in general, if there's no specific illness and they just don't feel good, they can certainly start fasting and see how they go.
Why don't they go to sleep? Tell them to go home. They don't have to be in shul the whole day. They can go home and rest at home and even go to sleep for a couple of hours. There's nothing wrong with that, to sleep on Yom Kippur if it's necessary.
There's somebody who is at home and sleeping and he still just doesn't feel well. Is that a chayla that we allow them to take shiurim?
If there's nothing medically wrong with him, he should fast unless he feels he's fainting. You know, his category of come to chayla shem by sakana, that's one thing. But normal, in most cases, they feel weak. Most people feel weak on Yom Kippur for fasting all day. So they should take it easy. If they can't stay all day in shul, let them go home and rest and go to sleep. And they'll pass by a few hours and they'll make it to after Yom Kippur. There's nothing medically wrong with the person. He should just take it easy and wait it out. And that's it, like we all do.
So to clarify, if one wouldn't be a chayla sheyesh sakana, it's not a chash of sakana, it's a chash of being neifel mishkav, just being bedridden because of weakness of fasting.
Yeah, nafal mishkav, like you said, is not a heta for eating. It's only if he's yesh b'sakana or chash yesh b'sakana, but he just feels weak and so on. That doesn't. It's like we said, it's nafal mishkav, not enough of a heta to allow him to eat or drink.
Next question is about somebody who
tell all these people, Rabbanim should tell the Abittan that before Yom Kippur they should drink a lot, so they shouldn't get dehydrated. Everyone should drink a lot, so they'll be able to mitzvah go through the Yom Kippur the way it should be. Of course, the Yom Kippur is a hard tinus, especially if you live in places where the climate is very hot and so on, and then of course, they should take it. They have to drink a lot before the tinus. Especially, like we'll talk soon about probably pregnant women who get dehydrated fast. You have to tell them to be in a cool place.
I would add to the Rav, other than drinking a lot, which is very crucial, but sweating, you lose a lot of fluid from sweating. So people who walk up and down and go to shul, it happens frequently. Instead of sitting in shul, where it's air conditioned, and they go home and they come back and they sweat a lot, that's going to contribute to being dehydrated. So I think that's a very important thing.
The next question is somebody who gets very dry in their mouth very easily, especially when davening. On a normal day, they could go through half a liter of water during 1 hour of davening. Is this a medical condition? And what should they do on Yom Kippur? Should they not daven? Should they take shiurim?
There's a condition that causes dry surfaces, mucosal surfaces, called Sjogren's syndrome, where that's a medical condition. People get very dry. It's not dangerous, but they're going to be very dry to the point that they can really get cracked mucosa and the lips get cracked. So it depends how extreme it is. Usually it's not a danger in any way. Even if you have Sjogren's syndrome, you wouldn't be in danger. So mostly I don't see a need to drink. I mean, whether they have to just wet their mouth, I don't know if that's halachically permissible to just wash out the mouth and wet it.
Not
Without
do it.
swallowing, I don't know.
No, they should not do it on Yom Kippur.
Should not create saliva in the mouth.
Correct.
To such a person who finds it hard to either be davening or we tell them not to daven if this is davening causes a lot of the time to a dry mouth.
More important to fast than daven all the davening. They should daven the ikrim what they have to daven, and that's it. They don't have to be there for chasor shots. They don't have to be there for kriyas hatayra if it's hard for them. They should cut out different parts of davening, which is mutter for everybody in Makom Tzarech.
And for such a person, what would be the minimum that will tell them that they should just daven if this is what they feel that they get very dry in the mouth?
They have to be honest with themselves. They should have to daven what is, they should speak to the Rav, and the Rav will tell them what is crucial to daven and what they could skip and what they can to get by on Yom Kippur. Some people have a rough time every Yom Kippur. They should be guided exactly what they could do on Yom Kippur.
Okay, we'll get to a few specific illnesses that were sent in. A 13-year-old boy who had his colon removed due to colitis. He's now better but prone to dehydration. What's his medical status, Dr.
Yeah, he would be prone to dehydration, and the transit time of things getting through the GI tract is going to be much quicker than normal people, where it goes to the small intestine and to the large intestine. It takes much slower. So a person like this, things have moved much quicker. So he will be prone to being dehydrated. And I believe one has to be cautious with him. And if necessary, he has to drink. I mean, speak to his doctor, obviously, who knows him, his GI doc, and to his rabbi, but he will be prone to being dehydrated more than someone else.
Can you give it some guidelines for cancer patients regarding fasting, patients who are on chemotherapy or radiation? What information when somebody asks a Rav that they are one of these types of patients, what should the Rav know and how to move to?
So it's interesting. There is an approach at certain points in time that fasting is quite good with chemotherapy. It enhances the effectivity of chemotherapy. And some people, it doesn't have to be a full day, but at least a 12, 14, 16-hour fast sometimes helps the effectivity of chemotherapy. But there is a certain point that people get to with chemotherapy that they're into. The body is catabolic, it's breaking down, which means they're extremely weak, and it can make their condition worse. So if they're in the point of doing chemotherapy or radiotherapy and they're still strong, there should be no danger in fasting. When they get to a point where they've had quite a few rounds of chemotherapy and they're starting to get catabolic, losing weight and getting very weak, it can be damaging. So I think they should work with their oncologist, but at that point in time, they should not be fasting because it can make things worse.
For those people, according to the doctors that deal with here in Chicago, they're okay most of the time with shiur.
Yeah.
So
yes.
on the shiur, and throughout the day, they can have liquids.
Right.
And we tell them they don't have to only use water. It could be apple juice, orange juice, grape juice. It could be different milk. It could be all different type of liquids. It doesn't have to be water.
Right.
And they shouldn't. That will help them get through the day. But most of the people who are on chemotherapy, they could They could be yaitze with the shurim. Another important thing I want to mention: some of the patients that I deal with who are on chemotherapy, some of them are very guilty, feel very guilty that they're not fasting on Yom Kippur. I tell them, if they feel this guilty conscience, I tell them, just like it's a mitzvah for me to fast, it's a mitzvah for them to eat. If they're not strong enough and they have to eat regular, sometimes I have to tell them you can eat a regular meal. And even though they're upset about it, but I tell them that just like it's a mitzvah for me to fast, it's a mitzvah for you to eat. And you shouldn't have any guilty conscience. But l'chatchila, we try to do shurim. Most of the time, we are yaitze with shurim. And the doctors go along with it, and the patient goes along with it. But there's a few circumstances that they have to eat regular to get the koyach. And you have to, and the doctor and the rav have to explain it to the patient that it's a mitzvah to eat. And just like it's a mitzvah for me to fast, it's a mitzvah for you to eat. And I think he explained in such a way that the patient will go along with this and won't be machmir on himself.
If Dr. Dinner could explain a patient on dialysis, should he be fasting? Can he fast? What about a patient who received a kidney donation or a patient who just donated a kidney?
Yeah, so basically, I think dialysis would not usually be in the category of fasting because they're in a fragile state between the dialysis and the electrolytes and the fluid balance is fragile. I do not believe any nephrologist or dialysis doctor would let them be fasting. Whether they can do shiurim, I don't know, but that they would have to consult with their specialist on that. A person who receives a donation is usually much more fragile than someone who donated a kidney. A person who donates a kidney, certainly after a year, they're usually in good shape. If they've got good kidney function, they usually can start fasting, but definitely not within the first year. And a person who receives a kidney would be longer. And again, they'd have to consult with a nephrologist. I don't think they would be in the category of fasting, certainly from fluids, because their kidneys are fragile and a kidney requires fluid perfusion. And if we deny the kidney fluid, it can become dangerous and even irreversible damage. So I do not think we would want that to any person who has a kidney, some form of kidney dysfunction.
And they could start with shiurim, or
I think if they have enough fluids that is required, they would be okay. They'd have to push, the whole day with shiurim to get enough, a liter and a half. I don't want to give an exact figure because I'm not a nephrologist, but they need enough to perfuse the kidney. And usually their specialist will tell them how much.
And one last general question for you, Dr. Dinner, is if somebody who eats and drinks shiurim all day, even let's say drinking shiurim all day, when he covers all necessary calories and hydration, when would it be a situation that shiurim will not be enough?
That's a good question. I think it's very personal and individualized. It depends on their overall situation. If they're sick and have a fever and they're trying to recover with shiurim and it's not working, we would say, depending on their generalized situation, they would now have to convert to not shiurim. So I think it depends on what their general medical condition is. If they're a heart patient, a kidney patient, and it's not enough for them, and they're still remaining weak and not improving, they would have to go to full. That's what I would say from a medical point of view. Halacha, I don't know.
Okay, we'd like to thank you very much, Dr. Dinner, for your time tonight.
Pleasure. Thanks for having me.
Move on to Dr. Abittan in a minute. Just before we move on to Dr. Abittan, if Rabbi Fuerst, if you could please explain, we've heard a few times the word shiurim. on a practical explanation. How does somebody take shiurim, and when they're told to take it, what's the time frame and the difference between eating and drinking?
We tell them, I mean, there's different shiurim out there. We tell them to take 1 ounce. If they have to take shiurim, they should take 1 ounce lechatchila every 9 minutes. If the doctor goes along with that, and
So yeah,
they only stick to the 9 minutes. Sometimes we have a patient that 9 minutes is too far apart for them. First, I'm talking about liquids, then I'll get to solids. If 9 minutes is too far apart, depends on each case, then we tell them every 4 minutes. It's really 3.5 minutes, but we tell them 4 minutes. And that should be throughout the day, and they could start already the night before. Even when your Kippur starts, it doesn't have to be starting in the morning. If it's necessary, they could do it the night. If the doctor feels it's necessary, then they can even start the night beforehand. That's negea liquids. Solids, you picture a shot glass that holds only 1 ounce of liquid. Any food that fits into that glass, also, again, 9 minutes and 4 minutes. So lechatchila should have it 9 minutes apart. Now, they can use any type of food, and they can crush it and stick it into that glass. As much as it fits in, they can pack it in as much as they can, and that amount they can have every 9 minutes lechatchila. And if the doctor feels it's a b'diavad, then even every 4 minutes. Halacha, we pass like the Mishnah in Yuma, that oichel and mashke and drinks are not mitzdarf. So you can have them together. You can have the liquids and the solids together, eat it together. As long as they wait 9 minutes or 4 minutes, then they're okay to go through a whole Yom Kippur like that. And most of the time, we have no problem. Patients make it through with the shiurim, and we don't have to come on to eating drinking. But there are cases that they have to eat regular. Sometimes we tell a patient, by him it should be like he can eat regular, but it depends on each case. You have to deal with a doctor and with the patient, and not even though Chazal say lev yudemos nashe, the patient says, I need this and so on. You have to know the patient. Sometimes the patient is not 100% all there mentally, so we can't be semech on him 100%. So we have to deal with each case separately, and we have and the Shulchan Aruch is the one that guides us what to do.
The Rav gave chizuk about people who want to push themselves to go to shul, and instead the mitzvah for them the main mitzvah is the fast, and that they should rather stay at home than go to shul. But many times the question comes up is the husband, who, if the wife is home watching all the kids, so then she might have to take shiurim. If it means that the wife would not have to take shiurim if the husband's home, does that mean that the husband also should stay home from shul?
Yes, he should come home a number of times during the day, help out his wife. I mean, all of us have. When my kids were young, I came home a few times on Yom Kippur. I'm sure many husbands do that to make sure that everything's going okay. And sometimes it's good to a husband to be home, so she should lay down a little bit. You know, having children is a shutfus, and sometimes you can't be in shul all day. That's part of the Baruch bench with children. You have to, and she has, and the wife has to have the courage to go through the time to Yom Kippur also. So the husband has to be there to help his wife to rest, so she'll be able to fast Yom Kippur. Especially if she's a menekes, she's nursing the baby, or she just got birth. If he can't be home, then at least she gets some help. Hire a non-Jewish girl to be there, or get someone to be there with her, so she should be able to rest and get her koyach, have enough koyach to last through Yom Kippur.
On the topic of shiurim, as what would the Rav say, Ensure or other fortified liquids would be considered, a liquid or a food?
Ensure is still a liquid. And it goes in the category of liquid that I mentioned. Even though it has a lot of nutrition in it, but still considered a mashka. You have to drink b'tachshir. There goes in all the clone of a mashka.
And just for
something-
those internationally, the Dayan Fuerst mentioned an ounce as this year, it's about 29, 30 grams.
I could just tell you in grams. I could tell you in what fits in the schnapps gläser. That's the amount that should be used. It's not totally in weight a lot because it depends on type of food. Certain foods are a lot lighter than other foods, and if you go with ounces, it's probably certain foods are going to be a lot heavier in that schnapps gläser. But this is my Kabbalah that you work with the glass and that's it. I know that many different shittas out there, but this is what I was makabel from our Rebbe.
You have to be careful that the schnapps glass is only an ounce. Sometimes
Right.
they make different sizes.
When you use a schnapps glazer, you have to make sure it's an ounce. Some schnapps glazer today, they're an ounce and a half or 2 ounces. Depends on the size. You have to measure it before Yom Kippur to make sure it holds an ounce. Sometimes you have these cups, when you take medication, they have on the side of the cup, they have, half an ounce, teaspoonful, they have a certain amounts there. You have to be careful with the shurim dish, to measure them and work with it before Yom Kippur to know exactly. You should not be, because sometimes you use a kais every 9 minutes. You use one and a half ounces. It's a lot more than you should be, and you're being over each time because it's no more chatzi shir. It's a lot more. So you're right. You have to make sure that holds an ounce, only an ounce. Okay.
Okay, thank you very much. We'll invite Dr. Abittan. Dr. Abittan, are you with us?
Hi, I'm here.
Hi, good afternoon. Dr. Baruch Abittan is a OBGYN in Woodman, New York, practices medicine at Premium Health Center in Brooklyn. And he specializes in halachic guided women's health. And we appreciate you taking the time and canceling clients in the middle of the day to address the questions that have come in.
Thank you. It's a plus.
So we'll start with nursing. Women who are fully nursing, what's the general guidelines? Women who feel weak during nursing or have a possibility that there might not be enough milk. How would the doctor advise on that?
So first discuss the Dayan. So in terms of nursing in general, I mean, I'm not going to get into the halachic side of that technically nursing ladies are, part of the same obligation to fast. And so we work towards that goal. So in general, short-term fasting, which is what Yom Kippur is, it's officially 25 hours of a fast, as opposed to, some individuals that might do intermittent fasting or fasting for days or weeks at a time. Officially, short-term fasting should not affect milk supply in a regular, normal, healthy situation. Just like every other medical condition, we usually recommend that any nursing mother should drink a lot of fluids, more than she thinks. Just keep on drinking and drinking leading up to the fast. It's definitely a very challenging day for anyone nursing. I've certainly heard the sentiment that it's even more difficult than fasting while pregnant is fasting while nursing, because it does take a lot out of you. However, in general, nursing while fasting for 25 hours over Yom Kippur while nursing is usually fine and healthy for both the mother and the baby. In most regular situations, I would recommend keeping track of diapers for the baby, making sure that that's going well. Severe dehydration, on the other hand, that's dangerous for mother, and that can affect milk supply. So short-term fasting usually doesn't. Severe dehydration usually does. I missed the very beginning, but when I did log on, I did hear a talk at the time from the doctor about severe dehydration, and I agree with that sentiment. It doesn't happen in one day for most healthy individuals. And so usually if you stay very hydrated in the days leading up to Yom Kippur, severe dehydration should not occur. And so you should be healthy, and milk supply should not be affected in most scenarios.
But if the woman is feeling very dry and weak from nursing?
So that's already a slightly different situation, and that also starts getting into more of a halakhic discussion and a halakhic shaila. the general guideline is that you will feel weak. You'll feel quite weak, but just to try to keep track of is the milk being affected or not? If milk production is being affected, then that's something that, would be a shaila in terms of drinking shiurim or full drinking. But if the milk is not being affected and this is someone who's feeling weak, I would look at it as a scenario where someone who's not nursing, in that scenario, if someone is feeling extremely weak, that's someone that probably needs to drink in some respect, likely starting with, I would defer to the halachic standpoint of likely starting with shiurim and seeing if that's able to alleviate it. Because again, this would be a scenario where someone is feeling weak due to a known reason, milk production, nursing, probably being very tired as well, and putting all that together without an additional high-risk scenario, they could likely just start with shiurim, see how they feel, and over that hour or 2 hours, actually shiurim gets a decent amount of fluids in, not huge, but it's a decent amount, and to see how she feels in that situation.
Is there a difference in age if it's a 2.5-week-old, 3 month, 6 month? Is there a difference in that?
So the first, usually not in terms of her health and milk production, the very, very beginning of pregnancy, so we're not talking right now about the first 3 days, but let's say within the first couple of weeks of pregnancy where milk production is still increasing, there probably is a little bit more of a nuanced approach in terms of where she specifically is in her milk production. So if milk production has fully come in, if there hasn't been challenges, sometimes in the first 3 weeks, there's extreme challenges with nursing, and that would be an individualized, personalized situation and shaila. Most likely, the principle still applies, which is staying extremely hydrated in the days leading up to Yom Kippur. Those 25 hours likely would not change the outcome or likely would not affect the hydration leading to milk production too much. If she's in a scenario where there's already been a significant challenge of milk production, already a significant issue that she's dealing with, she should make sure to discuss with her doctor and her Rav before Yom Kippur comes to know what to plan in advance. But likely in that scenario, there's much more reason to consider shiurim either starting off in that morning or, most of the time shiurim should be able to accomplish what's necessary for nursing, even in those situations.
What does the Dayan say about the halachic standpoint?
It would seem to me that a woman who feels that she doesn't have enough milk, she's allowed to have shiurim throughout the day. If she honestly feels that she doesn't have enough milk, how does she know that? Let's say even there are some women that have a problem, even nursing bichlal, even when it's not Yom Kippur, is they're not producing enough milk. There are women like that. Most women, Baruch Hashem, produce a lot of milk, but they're afraid when it comes to Yom Kippur, they're not drinking for 24 or 25 hours, they're not going to have enough milk. But if we tell them they should drink a lot of fluids a few days before Yom Kippur, normally there's no problem. They go through Yom Kippur, and Baruch Hashem, they can nurse. Sometimes they run a little bit dry towards the end of Yom Kippur or Motzei Yom Kippur, but then they could replenish it right away by drinking. But if they do have to drink, if it's a type of woman that's not producing enough milk, we tell her she's allowed to drink shiurim. We don't tell her she should take Similac or any other type of things. Mother milk is the most important for the baby than giving the ones you buy in the store. And therefore, we don't give them an eitzah. They should use Similac or any other type of, to buy over the counter. They're allowed to drink shiurim, so they should be able to do mother milk if it's necessary.
What about back to the doctor, a specific case of somebody who has twins? Does that make it worse, or that just doubles the amount that she's nursing, so therefore probably she might get weaker faster?
Both. Twins does certainly double the amount that she's nursing. She certainly will likely feel weaker faster. In a situation, to highlight what the Dayan pointed out, in a situation with nursing, when nursing is smooth and nursing is working well, staying extremely hydrated can hold her through Yom Kippur. However, there's probably a higher chance, and she'll already know this beforehand, noticing what her relationship between hydration and milk production when she's feeding two babies at the same time certainly has a higher chance that she will need something along the course of Yom Kippur, either just from feeling very, very repleted, or from depleted, or from lack of milk at some point earlier on in Yom Kippur than someone who's only nursing one child at the time.
This, I think, might be more of a question for the Rav. It's a specific question of somebody who has a 9-month-old baby. She's fully nursing, and she tried fasting on Tisha B'Av. Baby nurses every 2 hours. It went very bad. A few hours before the end, she was terribly unwell. It was clear that she had to break the fast, but she couldn't even get out of bed. She was very dizzy, and she barely had any milk supply for 2 days after that. And for such a case, she should start, if she knows this is what her body reacts to fasting, should she start with shiurim right away?
She should start with shiurim. But in such a case, like you mentioned, I would say they don't have to wait 9 minutes apart. They could use 4 minutes, since she has to replenish it real fast and so on. So I would say she could semech on the shitas that every 4 minutes she should drink the shiur, and 4 minutes is not so far apart from each other. And I think that'll take care of it until after Yom Kippur.
Does she have to wait until she's not feeling well, or she could start right away with shiurim?
Lev Yodea Maris Nafsha. She knows her body. She knows how her body is going, and she sees, and a mother feels it. The baby is nursing, not nursing, and she feels, depleted and so on. Then she should start. She can be made. She feels she doesn't have enough milk. Then she could do the shiurim. I don't think it's necessary for her to drink on a regular basis, to be makel completely, to do regular drinking. I think shiurim does the job. And out of Yom Hazeh, Baruch Hashem, they all made it through.
The Rav mentioned
I would want to just point out is that this scenario and this question really highlights the importance of discussing with knowing yourself, and also discussing with your Rav before the fast day comes. Tisha B'Av is even a day that you can use the phone, but still it got to that point of a couple hours before the fast where she hadn't broken it and was unfortunately very dizzy, very unwell, what sounds like severe dehydration. So it definitely highlights, especially in Yom Kippur, it highlights knowing yourself and planning in advance to at least know, what am I going to do if I don't feel well?
The Rav mentioned that you do not have to give formulas instead, and if they feel that the milk supply is going down, they could have shiurim. Question is, do they have to pump, like do they have to start pumping before Yom Kippur to bottle feed the child beforehand, before going on to shiurim?
They don't have to do it, but if they know this is where the body is going and they're not going to have enough, it doesn't hurt to pump beforehand to have, just in case, as a backup, some supplies. There's nothing wrong with doing that. But you don't have to come on to using formula. Mother's milk the Baruch created, that's the way to go, and that's it. It's not only Geya on Yom Kippur, it's Geya Shabbos also. If a woman is feels that she doesn't have enough milk, she may pump it to give it to the baby and not use Similac.
A woman, we'll continue with the next question. A woman who's 6 months after birth with borderline postpartum depression. She's physically healthy, but feels threatened emotionally about the fast. It's just too much for her and overwhelming. Do we take that consideration in to allow her to start with shiurim even if she generally feels okay?
I would say you should speak to the doctor. The doctor knows who's dealing with this patient, and preferably a frum doctor than a non-frum doctor or non-Jew, because they don't understand the chayma advarim of Yom Kippur. They should be dealing with if possible, a frum doctor, so he understands the severity of Yom Kippur, and discuss with him how to deal with this patient.
Okay, we'll move on to the next topic of birth control. The woman who's taking hormonal birth control, and she needs to take it at the exact same time every single day. What should she do on Yom Kippur? She's always taking it at 10 o'clock at night. Can she take it at 6 or before the fast starts? Is there going to be a problem with staining if she moves it up? What does the doctor advise?
So this is a very, very common question, comes up multiple times a year by most of the Tanaisim. And so what we usually recommend, there's different forms of birth control pills. Let's just break them down into two regular categories. One category of birth control pill has a combination of both a form of estrogen and a form of progesterone. And the other type of pill has only progesterone. There's other types as well, but in two most commonly used, one has both estrogen and progesterone, the other one has only progesterone. Women are told to take the pill at the exact same time every day. It's most effective when one does that. However, in the scenario of a combination birth control pill, so a birth control pill that has both estrogen and progesterone in it, actually deviating by a few hours in either direction will likely make no difference at all. In general, for most women, it doesn't cause spotting. It doesn't cause any problems for the contraception to work. And so usually what we'll recommend is if someone's taking a combination estrogen and progesterone birth control, they could just take the pill for Erev Yom Kippur just a little bit earlier before Yom Kippur starts. And the Yom Kippur itself, they could just take it Motzei Yom Kippur. It ends up not being a problem. One day you take it a little bit earlier, one day you take it a little bit later before and after Yom Kippur, so you don't have to worry about that. However, for a progesterone-only birth control, which is a very commonly used for postpartum while nursing, this progesterone pill called the mini pill or other things in different countries, this pill really does need to be at the same time every day for its to be most effective and to not cause staining. And so missing it or even deviating, some women even, moving it by an hour or two can cause some staining issues and certainly can cause pregnancy-related issues as well. And so that does need to be the same time. What the options are is that if she plans in advance, we do sometimes recommend trying to slowly either make the pill earlier or slowly push the time later by half hour or 1 hour increments, and so that she won't get staining or anything else. For example, if she takes it at, make it the worst case scenario, 10 o'clock in the morning, right? So 10 o'clock in the morning, every single morning, that's Yom Kippur morning, that's going to be a problem. So if she wants, for the 2 weeks before, she can slowly move it earlier and earlier until it ends up being at nighttime. And then right around the time of Yom Kippur to take it right before, lighting, and then right after Yom Kippur shouldn't be a problem with staining, shouldn't be a problem with getting pregnant as well. I usually recommend everyone take their pills in the evening time because it makes it easier anytime these issues arise. Once you're taking it in that late afternoon, early evening time, you get away from most of the problems. However, if it's someone that cannot move it or it's too late to move it, then we can ask a shaila from the halachic standpoint about maybe if it's unflavored and taking it without water, being able to swallow it at that time. That's certainly happened. I don't want to weigh in on that, but that certainly happened from my experience as well.
But as the Dine mentioned earlier, taking it without water is not a problem.
Yeah.
Correct?
Not everyone could do it.
I would like to mention that I would beg to differ with the doctor. I said, if you have a woman that's taking every day, 10 o'clock at night, the pill, don't make her a sugar. Let her continue taking 10 o'clock at night, even Yom Kippur at night, and take without water, and that's it. You start telling her to do it, half hour early, work your way until it's before Yom Kippur. I think even it's a good idea, but I think you're putting too much on the woman. She's taking care of family, bunch of kids. You start telling her this Tuesday, take it at 10. Take it at 9:30. Take then 9 o'clock, and this and that. I think it's not for a woman. He's just driving her nuts. She keeps taking 10 o'clock every night. Let her continue at 10 o'clock at night. She takes it 10 o'clock in the morning. Let her take it always 10 o'clock, so she should not stain. And she should have a regular time that she always takes it, and she knows this is the time to do it. I think if she has that clarity, and just tells her to take without water, and all women can take without water. So therefore, I don't think it's a problem. And I think instead of telling her to change it before Yom Kippur and so on, I think it's better she keeps on taking it the same time she takes it every day, 7 days a week. It should be including Shabbos, including Yom Kippur, the same time, and she may take it without water on Yom Kippur.
Would that apply to a kala who's taking pills to regulate as well?
Same thing at Kala also. Kala doesn't want to have a chuppah nida, and there's nothing wrong with taking, if the Rav and Dr. Edmonds taking the pill, even on Yom Kippur, she could take it without water.
Okay, so I think we'll move now on to pregnancy. Somebody who just got a positive pregnancy test just 2 weeks ago. Is it harmful at all to fast when they're pregnant? In general, what's the guidelines for pregnant women fasting? And a woman who has low blood pressure, what would the case be then?
So let's split those up for a minute. We could talk about low blood pressure separately because that's really would be its own a less common category. But in general, I mean, there'll probably be a bunch of questions about this. We'll try to give the general mahalach and the general guidelines, and then we'll see how everything does fit in along the way. But in general, in a first trimester pregnancy that's normal, healthy, there is nothing high risk about fasting, meaning fasting won't elicit a problem in a first trimester pregnancy. During pregnancy, women can certainly, not usually first trimester, but during pregnancy, if in the first trimester they're experiencing normal increased nausea, vomiting of pregnancy, or even if they're not, fasting can certainly elicit feeling lightheaded, feeling nauseous, or having some vomiting during pregnant. That's another category. But in general, to sort of look at pregnancy at maybe the first 20 weeks and the second 20 weeks, so the first half of pregnancy and the second half of pregnancy. You mentioned first trimester, but let's extend that just to the first 20 weeks of pregnancy, which is the first half of pregnancy. In that situation, fasting shouldn't cause any problems. We recommend very similarly drinking a lot before, like a lot of water in the days leading up, and likely staying in bed as much as possible during the day to minimize activity, to minimize the energy that you're expending. I'm not going to get into the halachic side of things about does someone need to stay in bed in order to fast versus not. That we'll let the Rav discuss. But usually the recommendation is to drink a lot leading up to the fast, to stay in bed as much as possible throughout the day. The nighttime, do whatever is necessary if they want to go to shul or if they're taking care of the kids, but stay in bed, arrange some way to enable staying in bed to minimize the activity. If it starts getting bad, to break with shiurim ideally. And then obviously if it progresses and worse, at least what we've seen is then, drinking more or eating more past shiurim. Over 20 weeks, now we start getting a little bit more concerned because now we're not as much in a regular healthy pregnancy concerned about the pregnancy itself, concerned about the pregnant mother herself, but now we're concerned about potential for contractions, labor, preterm labor, and things like that. If someone above 20 weeks and she is drank a lot and she's staying in bed and she starts feeling contractions, that she would need hydration. So in that scenario, she probably would need full drinking and not just shiurim, but I would defer, once we start talking about the very, very specific cases and details, we'll defer obviously to the Rav on those specifics. In high-risk scenarios, so one thing you mentioned was low blood pressure, so we can talk about that specifically, but in specific high-risk scenarios, someone who's at high risk for preterm delivery, someone who's at high risk for growth restriction of a fetus, when the baby doesn't get as much nutrition as it's supposed to get, and so therefore there's a less growth during the pregnancy than we would expect. Something called placental insufficiency. So for example, if the placenta isn't giving the nutrients that's necessary for the baby or other related issues, those are scenarios that have to be discussed before. They're likely all fine with shiurim from the beginning, because shiurim, you're able to get the adequate amount for those types of conditions.
And somebody who in the past had a failed pregnancy or miscarriages, and now they're at the beginning of their first trimester, does that make a difference?
So it's a very sensitive question. This probably depends on what she's feeling, a mixture of halacha, a mixture of medicine. Again, fasting in early pregnancy, when she's otherwise healthy and the pregnancy otherwise looks okay and is and there's no reason to believe that it should be in a high risk scenario, fasting shouldn't elicit problems. Changes in hydrations don't increase or decrease chances of miscarriage. We have very, very good data on women in early pregnancy, even with nausea and vomiting of pregnancy, even with hyperemesis of pregnancy, weight loss in pregnancy, and there are no negative repercussions on the baby in those scenarios. However, there's obviously certain recommendations that have to be taken into account. Drinking tons of fluids leading up to Yom Kippur, minimizing activity, and if this is more of a psychological, backdrop to the question of she had this miscarriage, she feels that fasting is causing her miscarriage, that has to be analyzed. From a medical standpoint, we would say with strong confidence that it likely is not. Fasting now is not related to the outcome of this early pregnancy. However, I guess she would need to judge with her Rav of how strongly she feels that, how strongly she believes that, and what might be her psychological state if, chas v'shalom, this pregnancy ends up in a miscarriage. Will she, have negative consequences of that, but non-medical?
But if she's high risk, let's say somebody due to her size or body type or blood type, I think it says body type. What this doctor said, they're not sure if they should fast. Saying that is more of a specific case, and that has more of a reason why not to fast.
Yeah, that would be a very specific case. I'm not sure. Maybe I don't have enough information about that. I'm not sure what a size or body type that would specifically make a pregnancy high risk, requiring eating or drinking over the course of the fast, but that would be a very specific scenario.
Mm-hmm. And the Dayan advise anything on what the doctor was speaking about?
Yeah. If it's a regular, normal pregnancy, and she takes it easy, and she stays in a cool place so she's not dehydrated, and she drinks a lot before the tinus, usually there's no problem whatsoever. It's a regular pregnancy. Just want to mention, Reb Shlomo Zalman Paskins, he writes that if it's an IVF pregnancy, then the first trimester, you could be makel with sure. That's what he writes in the Sefer Nishmas Avram. So it's a regular, normal, natural pregnancy. Then it's like the doctor said. But if it's a pregnancy that's through IVF, then in such a case, if Shlomo Zalman help, he can make a shurim in the first trimester. Because in the first trimester, it's more vulnerable to chas v'shalom to cause a problem. That's why we make it. But in normal circumstances, a woman in the first trimester should fast, and they should drink a lot. And I think it's very important they should be in a cool place the whole Yom Kippur, wear loose clothing, and also, like the doctor says, lay in bed as much as she can. She take it easy. I tell the women that not only that, did they feel a little bit weak, they could damage Shemona Esrei sitting down. They don't have to stand up for Shemona Esrei. Whatever it is to make it easy to fast and to go through Yom Kippur, they should do that. So make the fasting easier. But to make it so fast to drink in a normal way, I think they have to be speaking to a Rav to eat in a normal way. But sure, in the case of IVF, or it's a high risk or something like that, they should be in touch with a Rav. Sometimes a Rav will be makel for her to have shurim while she's pregnant. Depends on the situation.
IVF is even if they're feeling okay, and it's just happens.
Feeling okay. That's it, right. Take a look in the Nishmas Avram.
Okay, but a few other questions on pregnancies.
Also, just to follow up on what the Rav just mentioned. So my mother-in-law, Dr. Jessica Jacob, who is one of the leading from OBGYNs in the whole New York area. So Kanai Nara, she's been doing this and advising on this for decades. And Bli Ayin Hara, she reported when we were discussing this, that in this situation, in this scenario of pregnant ladies, taking it easy exactly as the Rav just described, of staying in a cool environment, in bed as much as possible, and staying very hydrated before the fast. She said, Baruch Hashem, Bli Ayin Hara, she has not had a problem, a single situation of a problem in decades of advising this to pregnant ladies. And additionally, she also pointed out that the other taina that sometimes is brought up is that this causes labor and induces labor. And she said in general, because all the from pregnant ladies are taking it so easy and are staying so hydrated before Yom Kippur and staying in bed all day, she actually does not see that. She sees less. She sees actually less labor and deliveries immediately following Yom Kippur and following Tisha B'Av than the rest of the year.
Okay, a woman who's expecting twins, is that a greater danger?
It's possible. If this is a twin pregnancy that is, there's different types of twins, and certain pregnancies might be more dangerous than other pregnancies. Certainly, someone who's expecting twins might be in the category of officially someone who's at risk for preterm labor or preterm delivery. So someone in that situation who's, by definition, twins have a much higher rate of being born premature. She's likely in that scenario of having that risk. Now, realistically, women are monitored during pregnancy. She's checked out somewhat beforehand. She knows if there's a real or not a real risk. Most of the time, she can probably start just the same as everyone else, but she would have a much, much lower threshold of at least drinking shiurim to keep herself hydrated to prevent any contractions.
A woman at the beginning of pregnancy was very nauseous, and she's asking, this is really also a halachic question of, is it okay to be on IV to make it, that she'll be able to make the day easier? Are we allowed to provide her IV for, to be able to cope throughout the whole day? She might not even have to do shiurim if she does that. And if she's already receiving IV, then because of her status, does she also have to eat? Or is just the hydration of the IV sufficient for both her and the baby? And what about if it will be post-birth? Would that be different?
So to clarify, you're referring to postpartum or
No,
someone who's pregnant?
there's pregnant and postpartum, both sides.
Pregnancy, I think, really would be a shaila for the Rav. If in general we know that it should not be necessary to be on IV or to drink shiurim. So I guess the shaila sounds like if someone would otherwise be okay with shiurim, should you specifically put an IV in before Yom Kippur to be able to give IV fluids and not require shiurim? Certainly IV fluids would give more than enough of all the electrolytes and everything that would be sufficient for the fast. So I think that would be more of a halachic shaila. Does one put an IV in before Yom Kippur to try to alleviate drinking shiurim when necessary?
And the Dayan shed some light on that.
It's a machlokes in the poskim if you should use the IV or not. But Yoshev and other poskim hold that you may use IV, and therefore you don't have to come on to shiurim at all, because you're getting constant through Yom Kippur, you're getting liquid. Ramosha in a tshuva writes against it. He holds you're not mechuyev to do that, and he holds it's even a question of chavola. So he was against giving IV. If there's a heter for her to have shiurim or to eat, let her eat, to drink. You're not mechuyev to do that. But if someone wants to be semach on those shitas that are meiko to give IV, if someone asks me, I said, listen, there are shitas that are meiko, and you can do it. If he asks me a psak, I tell them I should paskin on it. I says better don't use IV. Don't use IV. Live with what Shulchan Aruch says. If you could fast, fast. If you have to come on shiurim, then eat shiurim. If you're at the state where you have to eat regular, eat regular. So again, some machlokes in the poskim. Some say you should use IV so not to come onto it, and some say you don't have to come onto that. You do what the Torah Kedosha says, what says in Shulchan Aruch, and that's it. And don't use, extra things that the Shulchan Aruch doesn't require you to do. So again, it's I tell people that they should not, if they ask me Eitzah, I tell them better not use IV, and give them the directions. This is what you should do on Yom Kippur in case this and this.
And that would apply to putting in IV even before Yom Kippur.
Correct.
One who's already hospitalized, for example, and on an IV, which I believe the doctor said would be sufficient, should not eat or drink?
It's not necessary. Usually, in those cases, the way I understand, you're the doctor, You understand? If they're getting IV constantly in the hospital, it's not necessary to drink because that they're getting enough foods in their body. So it's really not necessary to give even shurim, unless for some reason the doctor feels besides the IV also need shurim. And of course, if the doctor says it's necessary, now I would go along with that.
So I do want to point out that, part of that question was, let's say someone postpartum, right? Someone day one postpartum, we know within the first 3 days of postpartum. So it's not necessarily routine to be on an IV, but assuming someone is in the hospital, is already on an IV, from a medical standpoint, why it's necessary to be drinking and or eating postpartum is likely related to nursing coming in, large fluid shifts from a delivery, blood loss from a delivery, replenishing, the energy and replenishing the blood in the body. So that would be the medical understanding. However, if someone is on IV, is getting all the electrolytes, technically that seemingly from a medical standpoint would be enough. But I'm not sure if that's necessarily what is always recommended in practice. If a lady is postpartum and from a medical standpoint we feel just being on IV is enough, whether that would hold true also from the halachic standpoint.
If she's already on IV, you may continue it. The question is to put them on IV on Yom Kippur, so they should be hydrated. That is a machlokes, like I mentioned before. The woman just had a baby. According to the Shulchan Aruch, the first 72 hours, she's allowed to eat a regular meal. And from 3 to 7 days, after 3 days till 7 days, depends if she says right Sani or not. According to my Rebbeim, you should let them eat. Don't put them IV then. However, if they're on IV before because she had the baby and she's IV, once she's on it already, you might as well leave it on it. The question is to put it on IV because of Yom Kippur. That I don't recommend. That's what some call from Rebbeim.
If a pregnant woman starts to bleed lightly on Yom Kippur or spotting even before Yom Kippur, will fasting be an issue?
So if a pregnant woman is already having spotting or bleeding prior to Yom Kippur, she, depending on her scenario, but in a decent amount of scenarios, she should probably discuss with the Rav to request shiurim because of dehydration, at least from the morning, not necessarily from the night, but at least from the morning because of dehydration when there's already a scenario of bleeding in pregnancy. But if something is an otherwise a healthy pregnancy and something new starts on Yom Kippur, new bleeding on Yom Kippur, that is probably grounds to not rely on shiurim and to go straight to actually drinking and breaking a fast. I would defer to Halacha on this, but this could be anything from the start of labor, hypoglycemia, multiple problems that can cause new onset bleeding. That's something that would be quite risky.
What does the Dayan say?
I think you should have to leave it up to the doctor. The doctor feels that her bleeding during pregnancy could be sakana to her or sakana to the fetus, and of course you're allowed to be mechal Shabbos and mechal Yom Kippur. There's not, of course, it's okay. I think it depends that she should be in touch with her with an OBGYN to what she should do exactly.
If somebody had a miscarriage and in the 4th month of pregnancy, do the halachas of afterbirth apply, or do we only see?
Yes, it's like a yoledis. We paskin that a woman who has a miscarriage, she has a din like a yoledis. All the halachas are yoledis. She has a miscarriage erev Yom Kippur, the first 3 days she has a din like yoledis. She's allowed to eat regular. Just we're not. The Mishabura says that even a yoledis should try the chatchila to be machma the first 3 days to even have shurim then also, if possible. But if she feels very weak, she can eat regular first 3 days, even if she's a mapelis, even if she has a miscarriage.
From what stage does she have halachic status of pregnant?
40 days. After 40 days, she has done like a yoledis.
Mm-hmm. Okay, we'll go on to questions of fertility, which we spoke about a little bit earlier. As the Rav mentioned that the IVF, anything in the first trimester should take shiurim, even if they're feeling fine. The question will be, what happens if they're further on after the first trimester, and they even had a history of a miscarriage beforehand, and they haven't been feeling very well. They've been feeling very shaky, dizzy, and unwell, and they have a history of low blood pressure and feeling faint during pregnancy. What should they do about Yom Kippur in such a case?
Question is,
This,
doctor,
yeah, this to me, this sounds more of a regular halachic shaila for the Rav, of feeling weak, feeling very faint on Yom Kippur. It doesn't sound healthy.
it seemed
But
to me
that it's an IVF. The fact that
after
it's
the
IVF.
first trimester, after the first trimester, she's like any other pregnant woman and goes in the same category. Whatever we paskin by regular woman, the same thing, woman who got pregnant IVF, after she's gone through the trimester and everything's Baruch Hashem Beseder, then she's like any other woman. Whatever halacha applies to a regular pregnant woman applies to her also after the first trimester. And whatever applies at that time. If she should, like any other woman, she should drink a lot, take it easy, and so on. And if she feels very weak, and the doctor would feel in such a case, she should have shiurim, let her have shiurim, like any other pregnant woman. But normally, if she follows the directions of the doctor and the Rav, normally everything goes well through the pregnancy. Like I mentioned from this Dr. Jacobs, from your mother-in-law, she's 100% right. I'm a dying for 43 years, and Baruch Hashem, I didn't have, in all 43 years, they followed instructions, and Baruch Hashem, they all carried through, Baruch Hashem. That's it. I could just say, I just agreed with Dr. Jacobs, and I see it b'einai. 43 years I've been dealing with this, and Baruch Hashem, everyone who's gone through pregnancy, Baruch Hashem, everything ended up well.
Well, somebody who's in the middle of ovarian stimulation, part of an IVF treatment, what should they do regarding Yom Kippur?
I mean, the same Shiloh, I'll let the doctor say, yeah.
No, this is at least in the US, this is exceedingly uncommon to ever be doing ovarian stimulation around the time of Yom Kippur, due to various issues relating with hashgacha during Tishrei. So it's exceedingly uncommon for someone to be going through this process. However, the question comes up multiple times a year with all other fast days and Tisha B'Av and everything like that. If this, and I'm not sure, maybe in Eretz Yisrael it is very common. I actually am not familiar, not sure, but we're not discussing the shaila of taking shots and scheduling shots and things like that. But fasting, we know from all year round, does not affect an IVF cycle in general in any way. It doesn't affect the response to stimulation, and it doesn't. And in general, a woman who is taking medications for ovarian stimulation, depending, as long as she's otherwise feeling well, which 80+% of the time in general, women taking the medications are feeling well, then fasting should not affect her more than someone who is maybe very early pregnant or someone else with slightly elevated hormones. So in general, women do totally fine through their IVF stimulation with fasting all year round, not just Yom Kippur.
Mm-hmm. And if somebody who's taking the progesterone orally, and as the Dayan mentioned, if she take it without water, if she cannot take it without water, is it a problem if she skips a day, if she's towards the end of the first trimester?
So in general, I have to make a chiluk because oral progesterone, there's a difference between oral progesterone in the US versus oral progesterone in Eretz Yisrael. In general, when oral progesterone is being used for early first trimester IVF pregnancies in the US, it is never a problem to skip that dose, but I would always double check with your doctor. But this has been what we discussed the last 2 weeks. Every single patient is basically skipping their oral progesterone from the morning of Yom Kippur. However, there is some oral progesterone in Eretz Yisrael that is much more important than the oral progesterone we use here. It's a different formulation. For that, I would ask the doctor that's taking care of her at the time, but most of the time, it shouldn't be a problem to take an extra dose the day before and an extra dose the day after, and not to change your schedule But if you're not able to swallow it or something like that, you don't have to make anything crazy. You could just skip the dose. It doesn't make any difference.
But if she's taking vaginal anyways, does she not have coverage, or does she still might have to take the oral as well?
It would depend, and certainly in America, it certainly wouldn't matter. You can totally skip the oral, especially if she's taking another form of progesterone. But there are certain progesterones that are much stronger and more important in an oral form in Eretz Yisrael. It probably still will be fine to skip it, but it would be in her specific scenario, she would just want to double check.
And as the Dayan mentioned that you should take it without water, but let's say the kala pills or any other pills that they take regularly, if they cannot take it without water, and even breaking it up, they find it difficult. What does the Dayan suggest about taking it with a bit of water, making it bitter?
She's not a chayla. She's not a chayla. Sheyesh b'sakana. She has to work it out. You have to convince her that there's no problem taking without water. It's hard. Let her try out during the week, and she sees it goes. And I had a number of patients like that they try during the week, and they see they could do it. There's no reason why they can't do it without water. They could use some saliva. The saliva they have in the mouth will go down. There is no heta chatzeshir asum natayra. That's it. Period. She's not a chayla. She cannot drink any water together with the pill, even a mashu. Nothing.
That goes for all the hormonal pills.
All hormonal pills, unless she's a category of a chash. Chayla sheyesh basakana, chash sheyesh basakana. Even chayla sheyesh basakana, there's no heta. Chatzeshir asum natayra. There's no heta. A Rav has to convince her, a doctor has to convince her that she can do it. And they do it. At the end of the day, the women that I deal with, they all do it. And at the end of the day, they make it through.
Mm-hmm. I skipped the question back to pregnant for a minute. Somebody who's 33 weeks pregnant, and she has gestational diabetes, and she takes Levemir, which is a long-acting insulin, once a day. She had 4 previous C-sections, and she's scheduled for a 5th one. And the previous scheduled C-sections. What ended up happening was that her water broke a few days earlier and was in labor. So she got to the hospital right away, but the scar already started separating, and the doctor says that it's very important that she does not go into labor again. What's her status for fasting?
She sounds like someone who is certainly at very would be in high risk if she starts having contractions and going into labor. She's probably someone that should likely discuss with her Rav about shiurim to prevent contractions, depending on where she is in the pregnancy. But certainly if she's, even remotely close to the potential of having contractions in pregnancy, she should probably prevent at least with shiurim.
If she's holding at the state that the doctor is willing to, she can have the baby then. She has a din like a yoledis, and therefore she can eat even regular. She has din like a yoledis. She wants to do shiurim, she could do shiurim, but she can eat regular. Mishabur says in Tov Reish Yud Zayin, and once a woman has chavei leda, real labor pains, she has a din like yoledis already, and all the halachos that the 3-day apply, even if she didn't have the baby yet. But she has strong contractions and is giving birth. If the doctor doesn't want to have the baby, it's too early. So then it's a different story. She wants to keep in the baby. So again, if the doctor goes along with shurim, let her do shurim. The doctor feels she has to eat and drink, let her eat and drink.
In general, what's the guidelines halachically for when a woman knows that it's called labor, that she's allowed to drink as a din yoledis?
If she's in the hospital, if she's in the hospital, in that case, that stage of the game, she's probably in the hospital. So the doctor will tell her, you can have the baby now, since she has done like a yoledis already. If the doctor says, we're keeping you here for a couple of weeks, and until we want you to keep the baby in for a couple more weeks and so on, then she doesn't have to like yoledis, but then we don't want her to lose the baby. So we allow her to drink. If the doctor feels shurim is not enough, then she can eat. But in most cases, the way I understand, they usually put an IV into her arm anyway to give her fluids the whole time. So the question is not so negay anymore, because she's getting all the fluids she needs through the IV.
But somebody who's not in the hospital yet, they're just having strong contractions, and they're coming pretty frequent. Does she have a din of a yoledis yet? She hasn't gone in yet?
She has real strong, the real stuff, every few minutes apart. She's in labor already. According to Mishmur, she has done like a lettuce already, and she could even eat regular. If she could do shurim, that's best. If she can't do shurim, because like the Mishmur says, even the first 3 days in the Shatzin, he says you should you should try to do shurim if you can. If you can't, then you can eat regular.
Somebody who has a UTI, is there a problem if they need to put on cream? Is there a problem of sicha? And in general, what's the status when it comes to fasting with the medical issue of a UTI?
Sicha is also on Yom Kippur only for the tainug. If it's a shame ripui, then the person can all say it's okay. So to use some cream for UTI, she's allowed to use it. If it's infection, then she's allowed to use it on Yom Kippur also. There's no sicha. Sicha is only tainig, but not for four.
And on a medical standpoint, somebody with a UTI, how important is it for them to drink?
So again, the doctor should answer that.
Yeah, in general, from a medical standpoint, we do like staying very, very hydrated for UTI to allow the system to kind of flush everything through. But staying hydrated in the days leading forward, I don't believe that in an uncomplicated, just a regular uncomplicated urinary tract infection in someone who's otherwise healthy, fasting should not make it worse.
One last question. After an episiotomy, is it necessary to allow to bathe in order to heal and prevent the infection?
In general, I'll answer briefly from a medical standpoint, but in general, after an episiotomy or any sort of repair that's performed after a regular vaginal delivery, bathing is not necessarily how I would necessarily call it, but certainly soaking the area and certainly washing the area is definitely helpful and important to keep it clean, to overall keep it dry afterwards, and to help with the healing process. How to accomplish that from a halachic standpoint, I'll obviously let the Rav explain.
What has to be done?
So usually at least what's recommended in the hospital, and it's there's frequencies that are recommended, but those frequencies are not necessarily evidence-based studied frequencies that are very clear cut. But generally they recommend 2 to 3 times a day, filling a small little basin with water, with certain materials on the inside, maybe Epsom salts or similar materials, and then soaking the area in that basin to allow any infection to be drawn out.
She's allowed to wash it out. She has to be careful about schita. She should use her hands, or she can wear rubber gloves and so on. Wash her immediate area there. There's no problem doing that even on Yom Kippur. Again, it's not rechitza shel tainig. So there's certainly, it's for a fuah. So certainly it's okay even on Yom Kippur. And as long as she's careful, as much as possible, not to ever schita, and when she dries herself, afterwards she should use a regular towel. I don't see a big problem. If she follows the Shulchan Aruch, she can do a good job of avoiding infection without being over any isurim.
Okay.
The Rav mentioned earlier about swallowing the pills. If it would be with a davar pagum, like chaymitz or something that's pagum and pachas michshir also, is that any makam lahakol, or it's either swallow plain or nothing?
There is, it's a Ramah and tough Rishud base. Just want to mention, I didn't mention about pogum because it has to be really pogum. It's a little dangerous because if you use something that's not pogum and you drink regularly, you're over Issa Deraisa of Yom Kippur, which is chorus. Therefore, I don't mention pogum unless there's a real tzarech gadol. But pogum means pogum. It has to be such a way that it can't drink it. It has to be emes pogum. So to mention pogum to regal hamoinam is not poshut. You can mention it because people have to understand what pogum is. And if it's not pogum, they be sur deraisa. It's a chorus. So therefore, the best thing is not to is just swallow. If it's a pill, swallow it with the saliva, and usually it works. There are some cases that we do allow them to use pogrom. We explain them clearly what pogrom is. It has to be not right, and they should already make it before Yom Kippur, have it prepared already, and make it in such a way it's pogrom, a real pogrom, so not be a risk of shtia on Yom Kippur. And when you use pogrom, you don't need shurim. You can have it as much as you want. There are cases that people have UTI, infection, so on, and the doctor says you must drink a lot because of this UTI. Then we recommend them to use water that's very pogrom. But we have to, to mention the hamoinam, the head of pogrom, it's a dangerous thing to say it because they have to make a pogrom. If they don't make a pogrom, then it's a drinking Yom Kippur, regular drinking Yom Kippur, where there's no heta.
What does the Dayan suggest how to make a pogrom for somebody who has a UTI?
I tell people to take a bag of tea, tea bag, and put it in concentrated water, make it real pogrom, real heavy, and usually it tastes lousy. It's really pogrom. That's what I tell them to do, and people have done it, and they said it's really pogrom. But again, like I mentioned, a Rav should not mention it so fast because of the kikulim that come out with it.
For swallowing a pill, mouthwash is not pogrom?
I don't think so. I don't think mouthwash is that pogrom. Mouthwash, some people even drink it. When they're washing their mouth, they don't even spit it out. They swallow it. Today's mouthwash it doesn't taste so bad. I don't think a mouthwash is a pogrom.
Okay, so we've gone through the questions. We'd like to thank all the doctors, Dr. Abittan, Dr. Dinner, and Dayan Fuerst. We have with us together today also many of the Halacha Rabbanim. If any of the Rabbanim want to ask questions, if the Dayan and the doctor has a few minutes, maybe we could ask and they could open up the mics.
Worrying about someone who has a history of kidney stones and their urologist has told them that they need to drink a lot every day in order to prevent it from happening again. What's the medical perspective and halachic perspective for doing, maybe drinking shiurim on Yom Kippur, or is that necessary or not?
If the doctor feels that he has to drink a lot of fluids when he has problem with kidney stones, it's like we just said now, that if they plug him the water, then they could drink as much as they want, but it has to be emes pogrom. And the Rav has to explain to him, how bitter it has to be. It's not right to drink at all. Then we'll make it. So it's a case like you mentioned, kidney stones, and he must drink a lot, and shum won't do the job. Then he could be piping the water, like Ramo says.
What about someone who's coming out of flu or corona and is very weak? Is there any mokum laken and shurim, or one shouldn't be?
Again, I didn't hear the question.
If someone is just recovering or in the middle of having flu or corona and is just generally very weak from that,
He has to speak to his doctor. His doctor tells him, and I advise always to use a from doctor, because like I mentioned before, a friar doctor or a guy doesn't understand, it doesn't have this, he doesn't realize the chayma advarim. He should really be dealing with a from Shem Shabbos doctor who he trusts, and speak it all with the doctor. If the doctor feels that he has to drink because he had corona and any type of other medical problem, and the doctor feels you have shurim, then let him have shurim. That's not for a layman to decide. He should discuss it with his doctor.
Dr.
And if he's a weak person, who says he has to go to shul? It's more important for him, the price can speak out, it's more important to him to fast the whole Yom Kippur than to go to shul and have shurim.
Dr. Dina, the COVID that's going around now as it's come back? Is it the same as it's been in the past, or it's the status of a flu?
Well, it's not the same, but it's not dangerous necessarily, mostly. And most people aren't naive. In other words, they've been exposed to some extent, either through vaccines or through getting the illness. So we're not as worried about it. And usually, very unlikely, Bezrat Hashem, people are not going to get severely ill. But if they're very sick, they may have to take, they have to have fluids and treat, because it is potentially quite a severe, they can get quite sick with it. So you have to speak to your doctor and Rav.
Dr. Abittan, we have a question here about someone who is 36 weeks at a higher risk for uterine rupture. So they wouldn't need to have a C-section if labor starts. They do around Yom Kippur. What should they do if they do start contractions? Is that something to be concerned about?
So definitely. It's something probably also to discuss with her doctor and her Rav, but briefly, if someone is around 36 weeks with high risk for uterine rupture, my assumption would be they're likely having a C-section in about 1 week, would be my estimation, usually around 37 weeks when someone's high risk. And so that might relate to what the Rav mentioned just a few moments ago, that if someone would be delivered at this time, if they started having contractions, let them have contractions, go into the hospital. However, in this scenario, I would probably just discuss with her doctor her specific scenario of, is it safe to be delivered if she starts having contractions versus not. Most of the time she would be able to get away with shiurim. Obviously, if she has contractions, she would need to go right to the hospital and drink.
The Dayan would agree that shiurim should be lechatchila first in such a case, or we say it's already tchilas leda?
I mentioned that even tchilas leda, the Shatzin says, even the first 3 days, the chatchila should be shiurim. It should be chatchila. But if the doctor feels the patient wants to, he may eat or drink already when he's in real labor.
Yeah, and it's just one last question, I think, and we'll wrap up with this, is what the Rav was saying was swallowing a pill and medications without any liquids. Would the same thing apply to a caffeine pill or other sorts of pills, or even iron vitamins, if somebody's supposed to be taking those?
Iron tablets are not necessary. It's not a tzarech. You can go 1 day without it. The caffeine pill, I think they can go 1 day without it. And plus, they can take it right before the tinus. And that usually does the job. To take it on Yom Kippur, I don't think it's considered a medicine, at least according to what I understand about it. And therefore, they should not take it on Yom Kippur itself. They could take it right before Yom Kippur, like any other medication that that is allowed to. But to take a caffeine pill on Yom Kippur, I think that's not considered a medicine, and therefore they should not take it on Yom Kippur.
And if they're getting severe headaches, then that will take.
If they're mitzvah haba, I mean, it does the same job like Tylenol. If someone's mitzvah haba, it's no different than Shabbos. Someone's mitzvah haba, just like if someone has a bad headache, he's allowed to take Tylenol on Shabbos, according to Masham and Ramosha. So therefore, Hu Adin, you're allowed to take on Yom Kippur also. But of course, on Yom Kippur, it has to be without water.
In other words, there's a chashash refuah with a caffeine pill?
Caffeine pill is not a medicine.
So why could you take it on Yom Kippur?
I said you should take it before Yom Kippur. I said if you listen clearly, I said the caffeine pill you should take before Yom Kippur, not on Yom Kippur.
Okay, so I think we'll wrap it up. I would like to thank again Dr. Dinner and Dr. Abittan and Dayan Fuerst and all the other Kabbalah Rabbanim which were on tonight. This is a very big toelis for all those who sent in the questions. Unfortunately, we couldn't get through to all the questions that were sent in on the chat, but you could all email them into info@kavhalacha.org, and we will try to pass them on to the doctors to ask them their opinion if we didn't cover any of those grounds. And once again, for those who didn't hear at the beginning, Halacha is available 24 hours a day, 6 days a week. And you can find all the information on kavhalacha.org. And Be'ez Hashem, everybody should fast well and have a Gemar Chasima Tova.